Hey guys, my name is Dr. Arora. I'm a TMJ and sleep apnea dentist in Connecticut in US. My office name is the TMJ and Sleep Doc. So today I'll talk about a patient, 26 years old, Patricia. She came yesterday. Chief complaint is headaches all around. Daytime headaches, and she wakes up with the headaches too at the same time. Like I noticed, I look into the mouth. It's a heavy grinder. Daytime clenching, tight clenching. Tongue is very tight. Anterior and posterior tongue tie. I'm surprised nobody looked at the tongue in the last 26 years. Problem eating, problem speaking, problem swallowing, problem breathing, and a problem like speaking at the same time. Okay. Neck was really tight, neck pain, shoulder pain, jaw pain, headaches, and poor posture like that. She was like as a computer IT professional, computer professional. Her all day long, 8 hours every day, 5 days a week, Monday to Friday. She was like that. We told her, sit straight, ears and shoulders in one line, lips closed, breathe through the nose, tongue on the palate. Every half an hour, check your posture. That's the number one thing. Like, where are your teeth? The teeth should not touch. Lips closed, tongue on the palate, teeth not touching, and breathe through the nose 12 to 14 times per minute. That is the number one recommendation, just to prevent it, just to prevent the clenching. Okay? Teeth should not touch. Teeth touch only when you swallow. Teeth should not touch at any other time. When you close your lips, tongue on the palate, relax, teeth are not touching. Tongue tie, that was the next one. Advise the tongue tie release. We'll do it next week. Before that, we have to start myofunctional therapy. I already started. Like it is 10 to 20 minutes every week I'll spend on her. We'll do almost 3 sessions. Then I release the tongue tie. Not next week, but after 3 or 4 sessions. Okay? After that tongue tie, we have to prepare the tongue for the release first. Okay? Her palate was really dome-shaped, very high palate. Okay? At this age, normal palatal expander won't expand the palate. Okay? If the tongue is free, actually tongue has to go up and rest on the palate. But the palate, the parking spot is not there for that palate, for the tongue actually. Okay. I'm looking into MARPI expander. It's a special kind of expander. It's like a skeletal expander. I talked to her about that. She's she's thinking about that. Okay. So about then the breathing exercises, myofunctional therapy exercises, tongue tie release, posture release. Okay, so all these like come into play, and plus craniosacral therapy, plus I'll give her a TMJ orthotic. So I'll just keep updating you with the what is happening with her, and if you have any headache issues, please call my office 203-469-5644 for evaluation. The TMJ and Sleep Doc in Connecticut. Thank you guys.